His A1C when we first met was 12.8, I believe, and it came down to 10.2 for the first follow-up. So when he saw that it came down, and him seeing that it wasn't just his wife that was on his team, but he had me on his team, he had Graham on his team, and everyone was really cheering for him and hoping for big successes for him, I think it kind of made him feel like he wasn't in it all by himself.
Tuesday night event, it's a free session, 7:15 to 8 o'clock. It's just patients who in conversation bring up the fact that they would like to know more, they would like to understand more of what's happening. And usually we'll go through 3, 4, some people will be 5 sessions. And we just talk and go through ideas, help them understand things. And we finish the last night with always a walk over to Food Line, which is the local grocery store behind us. And we just pick up canned goods, loaf or 2 of bread, look at different fiber counts, look at different carb counts, and just try to help them see what's happening with their food.
Numerous times I've heard patients say that no one's just ever had the time to sit down and explain everything to them, and they really enjoyed the one-on-one education sessions with us. They can actually see the whole process with doing point-of-care testing, and I think it kind of gave them more accountability of their own health care.
We have one particular patient that really comes to mind with that question, and he hasn't been able to afford the insulin that he truly needed. Found some ways to get some insulin in his hands. Found some discussion time with him. He's beginning to understand and look at his body and do some extra testing. And so he's beginning to understand how it's peaking and when they're peaking and what's going on with the system. And he's not having his dramatic lows, and he's not coming to me with sweat pouring off his chin wondering what's happening.
Not only are you dispensing medications, but including more of the counseling and more of the outcomes and things like that, you can kind of see the changes in their numbers, see the changes in their labs, and build a better relationship or rapport with the physicians that are caring for them. Hopefully, from the results and everything, we can kind of make this a case for providing the service in a retail setting.
Things of this nature are the basis for what will move the profession forward. I think products are wonderful when the products are good, when the products work for the person who's using it. But there's only one way to find out if the product's working, and that's the face-to-face interaction. The patients can't afford to go pay another copay to sit in the office for 40 minutes to have 2 minutes with the doctor for them to find out that the ability to, at some point, have a patient walk in the door and me to have the ability to take that 3 or 4 or 5 minutes just to ask what's happening is really where we need to go.